Hello, I'm Chris Slamer, and the purpose of this presentation is to quickly demonstrate how the use of electronic cigarettes can be documented in the rpms-ehr. Electronic cigarettes refers to the various devices that heat small amounts of liquid that contain nicotine and/or other substances such as flavorings and fillers to create a vapor which can be inhaled. There are many types of electronic cigarette devices, such as vape pens, e-cigarettes, and e-pipes, and they are sometimes identified by the brand names that make the device, such as Juul and Vuse. Electronic nicotine delivery systems, or ENDS, are devices that contain nicotine and are considered as a tobacco product by the U.S. Surgeon General. They became regulated by the FDA in 2016 as part of its goal to increase public health. Some devices may contain substances other than nicotine, electronic non-nicotine delivery systems. So we are using the term e-cigarette to refer to devices that deliver nicotine and other substances. E-cigarettes can be documented in the rpms-ehr as a health factor. Health factors were created to enable documentation of data elements that do not have current national standards such as ICD or SNOMED. The e-cigarette health factor was previously called ENDS. To use the e-cigarette health factor, ask the patient if he or she uses e-cigarettes, if they vape, or if they Juul. Then select the option that best fits with the patient's response. Current e-cigarette with nicotine user, meaning they are currently using the devices to inhale nicotine. Current e-cigarette with other substances user, meaning they are currently using the devices to inhale substances other than nicotine. Previous user is someone who used e-cigarettes in the past but has quit. Never used e-cigarettes refers to a patient who has never used one of the e-cigarette devices. Let's walk through the steps of documenting in the rpms-ehr. First, find the health factors in your EHR. They may be on the Wellness tab or in another location depending on how your site has set up the EHR layout. Once you've found the health factors, click on the Add button to add a new health factor to the patient's record. Scroll down to the bottom of the list. Here you will see the tobacco-related health factors for smoking, smokeless, chewing or dip tobacco, and exposure to tobacco smoke. The e-cigarette health factor is a little higher up since they are listed in alphabetical order. Click on the plus sign to the left of the health factor category to see the 4 options. Click on the option you want to document. It will be highlighted. Optionally, you can document additional information such as free text in the comments field. When you're done, click the Add button. This will add the new health factor to the patient's medical record. Health factors should be reassessed at least yearly. You can document the same health factor at the patient's next visit. If you don't use the rpms-ehr, new SNOMED codes have been created and are being made available to assist with the documentation of ENDS, including electronic cigarette, electronic nicotine delivery system, electronic cigarette user, electronic cigarette liquid containing nicotine, and electronic cigarette liquid without nicotine. Once the patient has been identified as an e-cigarette user, whether it be nicotine or other substances, you should encourage the patient to quit. Follow the 5 A's of ask if they use e-cigarettes, advise them to quit, assess their willingness to quit, assist them in quitting, and arrange for follow-up. Interventions can include recommendations for therapy, health education, referral to a tobacco cessation program, or referral to the 1-800-QUIT-NOW helpline or smokefree.gov text services. Patient education is an easy way to document the intervention. After encouraging the patient to quit, you can document the education using the TOQT education code or the tobacco abuse prevention education by using SNOMED. Patient education can be documented using the patient education component of the rpms-ehr. This is often found on the Wellness tab, however your site may have it located in a different place. Once you find your education component, click the Add button in the upper right corner. This will open the education code selection window. Scroll down until you find tobacco. Click the plus sign to the left of the tobacco to see the education code options. Click the code you want to use. It will be highlighted. Then click the Add button. However, there is an option to document additional information if you like. You can capture the patient's level of understanding as fair, good, or refused. The default is set at good, so be sure that you have assessed the patient and selected the most appropriate option before adding the education. The default is set at good, so be sure you have assessed the patient and selected the most appropriate option before adding the education. You can optionally enter the time spent on the educational part of the visit, free text comments, and the patient's readiness to learn. When you are done, click the Add button and the education will be added to the patient's medical record.
The use of EHR reminders can improve tobacco and e-cigarette documentation by alerting the clinician when a patient is due for screening and providing a dialogue to facilitate documentation directly through the note. Documentation of e-cigarettes is increasingly becoming an integral piece of medical record data, with reports of lung disease, illness, and death attributed with e-cigarette use. Documentation is important for providing patient care and identifying population health needs. E-cigarettes are also included as a component of the tobacco cessation quality measure and others. In conclusion, please visit the IHS Tobacco Prevention website, view a tobacco vaping poster from the Division of Oral Health, and check out the CDC website for more information about e-cigarettes.
Thank you for your time. I'd like to take a moment to recognize the members of the IHS Workgroup on Vaping.